Ever since Patricia started taking EpiJoint, which has that new ingredient Epitalis in it for mild arthritis, she's got a whole new lease on life. Even discovered a passion for blacksmithery. She makes horseshoes, medieval armour, and her favourite, the mace collection. She's out the back making a ceremonial claymore right now. Yep. She's never been happier.
Welcome everyone to the next webinar in Musculoskeletal Health Awareness Month's webinar series. My name is Helen Jentz. I'm a member of the Musculoskeletal Health Australia team, and I'm here tonight to introduce you to an amazing speaker. But first, on behalf of Musculoskeletal Health Australia, I would like to acknowledge the traditional owners of the lands from which I join you here tonight. We are streaming from the lands of the Eastern Kulin Nation and acknowledge the Boonwurrung and Boonwurrung and Wurundjeri people as the traditional owners and custodians of these lands. We pay our respects to their elders past, present and emerging, and recognise and uphold their continuing relationship to the lands and waterways. We also extend our respect to Aboriginal and Torres Strait Islanders joining us for this webinar. So, on to our incredible presenter today, Gerald Quigley, community pharmacist, master herbalist, author, media commentator on 3AW's House of Wellness, and all-round great guy. He's going to be talking today about consumer empowerment, medicines, and the importance of consumers and patients understanding and taking control of their health and well-being when it comes to musculoskeletal health. I do want to premise this presentation by saying that, as with all of our webinars, the views and opinions expressed are those of the presenter. So without much further ado, I would like to introduce you to Gerald.
Okay. Hello and welcome to an opportunity that you and I will have to try and explore some of the issues we have around keeping our joints healthy. And it's not easy. We're all living longer. Joint pain, musculoskeletal pain affects people of all ages, but sadly, those of us, and including me in this bracket, are finding that the longer we live, sometimes the aches and pains persist, and it gets more challenging as time goes by. We're going to be spending about half an hour together, and I have a number of things I wish to go through. The original topic is the role of herbs, but it's very hard to talk about an isolated thing, because the last thing I want to do is give you the impression that by throwing all your medications away and starting to take some turmeric and a tea a couple of times a day, that it's going to maintain your joint health. It's not as easy as that. So I'm going to talk about how we perhaps listen to our body a little bit more. I'll very briefly touch on medications and the issues around those. I'll then talk some specific herbs and some supplements, and then we'll go back and just revisit a very quick summary. And if everyone's okay with that, we'll get into it. One of the biggest challenges, and I'm a pharmacist and I'm a master herbalist, so some of my colleagues say I sit on the fence, but I don't think it's an issue of looking at one or the other. As long as we eat food, essentially, we're using some sort of herbal medicine along with our medications. But the important thing is, in all of this, and in a lot of communication I get through an Ask tab that I manage, is that we need to understand our condition. We need to know if we have a health issue, that we know all about it, or as much as we possibly can. We just don't necessarily have to go along with what we're told. Explore, ask questions, do your research. Dr. Google is a phenomenal facility, but remember, even though it's free, and as my late friend John Blackman used to say, anything free is worth every cent. So don't waste too much time on believing a lot of the stuff on Google. Always run it past someone face to face so that you are going to get an honest opinion from someone who takes some responsibility. And the other thing I try and emphasize to people, and I don't like the word patients because that implies that you're sick, we're talking here people, is that you you've got a particular problem, imagine that you're putting it in a shoebox. So it's not going to be on your shoulder all day, every day. You're going to just isolate this particular problem and get on with your life. And every now and again, it's going to pop out of its box and annoy the tripe out of you, but that's life. That's just the way it is. But we need to just move on. We need to get by with that. And if we can do that, you will be a happier person living with a problem that you can manage, and hopefully it will tend to manage itself after a while, but you will be optimistic in your quality of life. I mentioned asking questions, and I don't back away from that. Sometimes we're afraid to ask a question because it might sound a bit silly. I get a lot of feedback from patient focus groups, patient groups who get together and have a bit of a chat. Because if you've got a query, usually someone else has had that query before, and you can feel quite reassured that the question you're asking perhaps can be answered in a people-friendly way rather than a clinical way. We're all busy. Practitioners are busy, whether you see a specialist or a GP or a naturopath, whoever, everyone's busy, but remember the most important person when you're paying for their time is you. So don't be rushed. Prepare a list of questions in case you've got some. Don't be just pushed out the door. Just say, I'm sorry, I've got a few more questions. No one's going to mind. That's what we do, and that's what, out of respect, every practitioner, including me, needs to offer to you. We're also going to have some realistic expectations. There's a word called cure, and we don't cure many things. We live with them. We keep them under control. We subdue them. We control their symptoms to maintain our quality of life. But we throw this word cure around a lot. And I'm often asked, what's the herb that's going to cure my particular issue? For instance, joint pain. The simplest thing is often the thing that's overlooked, and we'll talk about those lifestyle issues later on. But remember that if you expect cure, the practitioner, the system can offer you the crutches, the support, but you have to play your role as well. And if we all play our role, usually we get a beneficial outcome, and that's what it's all about. I'll be briefly having a chat about medications in a moment, but be aware of the medications that you're taking. Some people I hear from might be taking a dozen or so. That's unfortunate, but that's just the way it is. Remember that medicines aren't lollies. They are important aspects to your health, prescribed to you by a person who is qualified to do that. However, sometimes there can be interactions, sometimes there can be adverse effects. So if you are taking something, particularly something for the first time, ask your pharmacist for a patient information leaflet. That's your right to take that away. Now, some of them can be pretty frightening because it will have a page of adverse effects. That's protection. That is a system which is in place to make sure that we are as informed as we can in helping you with your medication. And that applies to herbs and supplements as well. So if you take something and you feel that it's upsetting you or in some way interacting with something, get some advice, but don't ever hesitate to mention to your pharmacist or your GP, or you can do it yourself under the TGA, Therapeutic Goods Administration. There is an adverse event form that you can fill in. It can be completely anonymous, or if you wish further contact, you can just say, yes, I'm happy to be contacted. Nothing to fear, but that's the way we ensure that everything which is used across the board is as safe as it can possibly be. And also to try keeping some notes on how you feel. I mean, the experts call it keeping a journal. That's a bit fancy for me. Just keep a little record. When you wake up in the morning, what's your score out of 10 pain-wise? What's your score out of 10 mood-wise? And at the end of the day, do it again and just see how your day has been. You might find that a pattern develops. It could be the night your mother-in-law arrives for dinner or something, so you're stressed out and everything's in pain. If a pattern arises, then sometimes it's handy to know, and you can prepare for that. Another example might be if you're a golfer and you find that joint pain is really worrying your golf, then perhaps by taking something before your golf match, it won't be performance enhancing, but at least it will give you comfort while you're enjoying some sport, getting activities, mixing with friends, because it just goes back to those three words that I refer to all the time: quality of life. That's what we deserve, it's what we expect, and we need to work our way towards it. So with medicines, they're the important things. I can't emphasise that so much. I'm astounded by how many people take an array of medications, and there are obvious issues around how they feel associated with those medications. Now, it might be something simple like fatigue. It could be that they're not sleeping well because they're taking something at the wrong time of the day. Use your pharmacist. He or she is in fact the medication manager. He or she is the last point of contact you have between what your doctor has written on a piece of paper to legally supply you. Now, unless that pathway is clearly understood, then it all falls apart. And I've seen it happen. And that's not fair on you. It often is a waste of time and money from those who have been involved in that chain. So we've got to make sure that when you leave your pharmacy with his blessing or her blessing, the medication that you've got is going to work, it's going to make a difference, it's not going to interact with anything else, it won't interact with any supplements you've got. We've just got to make sure all of that happens. It's not difficult. We've just got to make sure we get involved. Getting involved in your own health, it's fundamental. So medications. Now, medications are usually strong. They're not designed to do anything other than get things back to normal as quickly as we can. Supplements, on the other hand, look at them as a little more gentle. I've always believed in all my herbal medicine studies that, pardon me, supplements are designed to restore to normal as much as possible. Not dramatically change anything. Restore as normal a function as possible. And we've got to understand those expectations very much. There's no magic solution to taking a single herb to actually control your joints and the health of your joints. We've got to check that they are safe and they're effective. Now that, in my view, wipes out any internet opportunity which suddenly pops up on your site. And it's funny how, again, I get emails from people saying, I just had dinner, sat down in the chair, flicking through my Facebook, and guess what? As my knees are aching and my shoulders are aching, this little thing pops up and says, have we got a solution for you? Buy this, usually from the US, where, mind you, they have no regulations. Their supplements are classed as food items. Here, to market a supplement in Australia, there's a very strict protocol. We have the strictest in the world. And sometimes we get annoyed when particular supplements we see overseas aren't available in Australia. There's usually a reason why. They could be unsafe, they could be untried and untested, they could have absolutely unrealistic claims, and don't get me started on testimonials. I have never seen a bad testimonial on anything that comes and is offered as a health supplement on a website. Usually written by the owners of the company, relatives of the owners, or probably shareholders. They just want your money. Don't risk it. The latest is, just slightly off piece, the latest is Ozempic, which is what everyone's talking about. There are fake Ozempic available now on the internet. Don't even go down there because it potentially could be fatal. Not on. So avoid those offers. I can't emphasize that enough. Just avoid them. Don't waste your time, or particularly don't waste your money. And similarly, now you walk into a lot of places that sell supplements. It might be a pharmacy, a health food store. And if you thought buying a supplement was simple, try walking down the aisle of those stores, because you are inundated with brands, marketing, claims, opportunists, all sorts of things. Get some advice. Now, if you are met by someone who you're not sure of their skills, just ask to see someone else. There's no point getting advice from someone who's worked in a pharmacy for a week. That's not really the way it's supposed to go. Remember, this is important. You are seeking advice for a supplement that is to blend with your medications, so you go to the top. You won't have to wait a few minutes to see the pharmacist, but ask questions. What can I expect from this? Will it interact with my medications? Here's my list. You should carry a list with you all the time, by the way. Put all your medicines on a little list, a little cue card like this, pop it in your wallet or bag, so you don't have to think. It's surprising how many people can take a tablet every day until they're asked what the name is. They say, but no idea, it's red, which narrows it down to about 300. So we need to know exactly what we're doing, in fairness to you, because not all brands are the same. If we talk particular herbs, and turmeric comes to mind, it has different rates of bioavailability, a big word which means there's no point swallowing it if it doesn't get dissolved in your tummy and get through your system. Turmeric's also a spice, so if you're taking a medication for reflux, it doesn't seem logical that you would add something that potentially is going to upset that reflux even more. Makes sense, doesn't it? Ask for advice. But on the other hand, there are some extracts of turmeric which don't cause this reflux, and they're the ones that your pharmacist hopefully will recommend that you consider. So there's ways around it. They're not dead ends, and that's only one herb I've mentioned. There's a lot of others, but that probably is the one of choice that most people talk about. Keep notes on how you feel. Let your GP know that you're taking that supplement as well. They often don't have the knowledge of the supplements. In fact, some pharmacists don't either, but they've got access to the information. And if you've got your little list of medications, write that supplement down on it as well, so that anyone who comes across that, God forbid if you've been cleaned up by a car and they're looking at what's going on, if they find that in your purse or wallet, then it just might mean that the next stage might be a little simpler. So keep notes, keep a bit of an idea of how you feel, what you're doing, and what difference that supplement will be making. And bear in mind, and this applies for medications, if you're taking these things and they don't make any difference based on your scale night and morning, speak to someone. There's no point taking a medication or a supplement if it doesn't make a difference to the quality of life. There are those three words again. You're just wasting your time, you're not helping yourself, and probably you're getting as miserable as all blazes because you're not being able to do the things that you would normally do. So, before I move on to herbs, I want to talk about lifestyle. And you've got all these experts, we all talk lifestyle. What does it mean? And there'll be others in this series who might be able to give you different variations on this, but to me there are 5, I like making lists, and there's just 5 very simple things. They are simple but very hard to implement because we're all comfortable in our own skin and we just know what's best for us. But sometimes our bodies say, well, that's not quite right, we need some changes. Number 1 is comfortable exercise. And that doesn't mean going to the gym and spending money. It doesn't mean getting out in lycra and puffing along the beach. I live in Bayside. I come across a lot of joggers every day. None of them smile. They don't look as if they're enjoying themselves. So just be comfortable. Get some advice on footwear, because if you've got sore knees, sore ankles, sore hips, there's no point you wearing the Kmart, perhaps I shouldn't use your name. There's no point using a cheap version of a walking shoe, because that shock impact will work all the way up to your spine and your body will pay for it. So you may have to pay a bit extra with a bit of advice from one of the properly qualified shoe athletes, better still a podiatrist or a sports podiatrist who can assess your gait and give you best value for the $100+, maybe even more, that you spend on footwear. If your exercise is every day, well done you. Well done you. Any exercise is all contributes to the exercise equation. If you can get outside, particularly with a friend, and you have that sneaky coffee at the end, all the better, because it'll make it more enjoyable. Everything we do, we should enjoy. Number 2 is adequate sleep. It's such a common inquiry that I get. No one sleeps these days for all sorts of reasons. There's a thing called sleep hygiene, which doesn't mean that you have a shower before you go into bed. It simply means, very quickly, you set a time for bed. And those of you that have had children will know that routine was very important for kids. But when we're adults, we know better. We throw the routine out the window. Set a time for bed, whatever. Take responsibility. Big question. How do I decide? Just pick a number. So it's 11 o'clock. At 10 o'clock, turn off all screens. No sneaky looking at Facebook, no sneaky looking at iPads. All screens, bright lights. Read a book, not a magazine, under a lamp, under a reading lamp. A book that you can pick up night after night after night. Put on the kettle, enjoy a cup of tea and small snack. Mine's a couple of dry biscuits and some cheese, whatever. If it's musculoskeletal, I'm a magnesium fan. I'll refer to that a little bit later, but magnesium is a gentle muscle relaxant and it will actually get you in the mood for sleep. If your mind's racing, well, then you can buy other herbal supplements which tend to settle a racing mind that are quite safe as well. So there are other options. So that gives you, and what you're doing is you're teaching your body and your brain that it's time for bed. How difficult is that? It takes 6 weeks to re-establish that routine. Your bedroom's got to be cool, dark, quiet, and absolutely no screens. No screens at all. Now, you'll find after a little while, you do nod off to sleep. But if you wake up at 2 o'clock and 3 o'clock and think, oh God, I've got this tomorrow, that tomorrow, get up out of bed, flip your pillow over, pull the covers back, go to the bathroom, have a few sips of water, get back into a cooler bed, you'll go back to sleep. Try it, I bet it works. Simple. Give it a try. Whatever your favourite tea is. No coffee, tea. Control stress. Stress is a pro-inflammatory fact of life. You wake up in the morning, you listen to the news, you read the paper, your stress levels are firing by 8 o'clock each morning. You've got to be able to understand that there are some things we can control and there are many things we can't control. Forget about the things we can't control. I know it sounds easy, but there's no point you getting in a hissy fit over something that's going to really annoy you, and all it does is increase your levels of inflammation, which you will feel in your joints, in your knees, in your hips, shoulders, wherever. If you drive the car a lot, you'll feel it in the tension when you're hanging over the steering wheel. Driving used to be fun once upon a time, it's not now. So if you're picking the kids up from school, or the grandchildren, your stress levels will be high. You've got to learn ways to switch off. We're all different. There's lots of experts out there, lots of good stuff on the internet of ways to keep your stress levels. But if you sleep well and you exercise regularly, your ability to cope with stress will be far better. Watch what we eat. Weight control, weight management, whatever way you want to turn is there. We live in a fairly plentiful society these days, and we can really eat and just pick up anything as we walk around a grocer. It's a matter of being sensible. There's all sorts of ways that we can measure your weight. We can do body mass index and all sorts of things, but the simplest thing is the thing that goes around your waist to keep your pants up. If that's starting to get tight, there's a fair chance probably you're putting on a bit of weight. Now, mainly that happens because we all, in the comfort of our own homes, eat more at night time. And then what do? We sit and we watch telly, and we look at the screens, and we nod off, and that means we don't sleep later on. If you can eat earlier, if possible, perhaps have a little more at lunchtime and a little less at night, get out and go for a walk before dinner or after dinner now that summer's approaching. Any way we can just help keep our weight under control without being drastic about it. And about what we eat, you hear all sorts of references to the Mediterranean diet. That again is a fancy way of saying we're just eating clean food. So salads. Sure, you can have meat, you can actually have a glass of wine, you can actually have regular dairy, but it's a matter of just going about your business in a sensible way and not eating heaps. Don't go near ready prepared stuff, don't go near fast food. I know it's cheap, but it comes back to bite you. It's just not worth it. Time for herbs, and I've got 1, 2, 3, 4. I'll talk 4 briefly because they're very commonly known, and I'll point out what they do and what role they play. I mentioned it before, turmeric. It's only been around since the early 1800s, so it's not some fancy new herb that's been discovered, particularly because the new herbs are, and you see them marketed, don't they? It's been found in the deep jungles of the Peru jungle, and it's expensive because not many people know about it. That's all rubbish, forget about that. Look at the things that we know about and we've studied. Many of you will be taking non-steroidal anti-inflammatories. There's a whole list of them readily available over the counter. And what turmeric does is mimic those pathways. Fancy name, they're called a COX-2 pathway, and they reduce inflammation. I continually am surprised the number of people who start taking turmeric and realise that it is making a difference to their joint pain within a relatively short time. The evidence says it reduces levels of inflammation. How often have I mentioned that? You'll find that on your blood test. When you get your blood test done, there's a thing there called CRP, C-reactive protein. If that's up, you'll have inflammation. If it's down, you don't have inflammation. Turmeric reduces that. It helps your walking performance. So if you're going to go for a walk every day, wow, how good's that? Particularly if you're carrying a golf club. And it often reduces the need for the non-steroidal anti-inflammatories, which bring side effects. So a lot of them that are available over the counter, they have a warning on it, but no one reads labels. The warnings are it might make you drowsy. No one worries about that. It also should not be taken for more than 7 or 10, depending on the medication, without checking with your doctor. No one takes any notice of that. These things, even though they're available, do have an effect on your kidney function, on your gastrointestinal lining, so there are risks in having them long term. What turmeric seems to do is reduce the impact of those. It reduces the need for the high doses of those things, so they can blend in beautifully. Again, get some advice, please. There's all sorts of doses, there's all sorts of extracts, and that's why the advice is important. I work in dry herbs. I think that's the way to go because it's the more natural form, but there are some fancy options available. That's what the advice component is helping you to decide. And until you take it, you really don't know whether it's going to work for you. Like medications, we can't guarantee. You've just got to give it a crack. If it helps, you'll know. And if it doesn't help, well, fine. At least you've given it a go, and maybe there's something else. So number 2, and often is combined with turmeric, is ginger. Our grandparents used it. We used to buy ginger beer and all sorts of things in the old days, but ginger, again, mimics that COX-2 inflammatory pathway. So it reduces inflammation. Actually, it's very good for reducing nausea as well. Now, that's been around in Greek mythology since the 13th and 14th century. Been around for a while. So nothing new, nothing fancy. And yet we often ignore the simple things. Reduces pain and reduces swelling. Hello, how often does that happen? Now, bearing in mind it's also a food-based herb, it's really safe as well. Again, get advice. It also reduces, according to the research, post-exercise muscle pain. How often do we find we make a little New Year resolution and we get stuck into it? I'll tell you what mine are. My New Year resolution, which I actually renew every year, I avoid like the plague couscous, quinoa and kale. Don't go near them, and I reckon that I'm one of very few people who stick to their New Year resolutions. So think of ginger. Ginger and turmeric combined works well. There's often other herbs in some of the formulations, things like magnesium, things like willow bark. There's all sorts of options, but the main ones are there to do the job. Have a look at the information, have a look at them. Glucosamine's been around for a long time. Now, it's not really a herb, it actually comes from shark cartilage, as does its component chondroitin. So if you have an issue with seafood sensitivities, probably not for you because it can cause a skin rash. But what glucosamine does, it rebuilds cartilage, and the evidence is clear. They did a study many, many years ago comparing ibuprofen, very commonly available, with glucosamine, and they found after 30 days, the ibuprofen reduced pain very well within 7 to 10 days. So it was a rapid relief of pain. Glucosamine did as well, but it took actually 30 days. But once that 30 days was up, it maintained that quality of life again. So glucosamine, simple. Does it affect blood sugar? No. Does it interact with medications? No. But get some advice anyway, because there's a string of availability there. The important thing is, and the research clearly shows, it slows disease progression in the knee. So we're talking osteoarthritis in the knee, very common. It's worth having a look at glucosamine, 1500 milligram per day, preferably in a split dose over the day. These are all exciting things, little tweaks to make a difference. As I mentioned, it's as effective as a non-steroidal anti-inflammatory, but a slower action, and it helps rebuild cartilage. Now, the cartilage is part of the cushioning substance in the knee. You've heard the phrase bone on bone, and that usually means you're heading down the pathway to a joint replacement. But if you can get it early enough, actually that joint space, which is the impact, and that's why you've got to wear good shoes, that's absorbed far better. So when we used to jump off fences and things as kids, it was the shock absorbing ability of the cartilage that actually made the difference. So restoring that as much as we can is worthwhile. None of us eat enough fish. I mentioned the Mediterranean diet before, and fish is the preferred protein in there. Fish oil, omega oils, are sources of things called essential fatty acids. There are two main ones that we measure in our medical circles. They've got shortened names to DHA and EPA. And when you turn the label around, you'll see those two things listed. And there are two strengths. We know now you've got to have about 1,000 milligram of that combination, which means you have to look at the triple strength one. Having low dose fish oil is better than having no fish oil, but not much. So if you're expecting a result in your levels of inflammation, get some advice on the best marine oil. And there's a string of them. There's fish oil, there's algal oil from algae, there's krill oil, and there's also a number of other things as well. But it's the omega-3s, the essential fatty acids that you need, and they, again, how often have we mentioned it, reduce inflammation. Reduce the inflammation, and the world's a happier place. New Zealand green lip mussel is another, particularly good too, by the way, if you've got asthma. Good for lung strength, but it actually is a powerful anti-inflammatory. Now that's different than the liver oils. Cod liver oil is different. It's a source of A and D. It probably will help a little in joint health, not much. So you better just stay with the fish oils and get some advice. I mentioned before magnesium. It's the simplest thing to help you get muscle relaxation and get some quality sleep. Don't hesitate to get some advice on a little bit of magnesium each night, because most of us don't have enough in our food sources, unless you eat a lot of nuts, but that's really the best food source that we've got of magnesium. In summary, before we have Helen join us, understand your body, know all about your medications, seek advice on herbs and supplements, stay away from that internet rubbish, and I wish you as much quality of life as you deserve.
Gerald, that was amazing, and you raised some really, really interesting points about consumer empowerment, which is what musculoskeletal health is, right. Australia is all about. I find it interesting, your commentary around Dr. Google, because a lot of the feedback we get from our consumers are that's their first port of call. So how do you recommend to consumers that they assess what quality information is, even if it's from the internet? What is quality information? And then when they have that quality information, what should they do with it?
We have to remember, Helen, that Google is an assembly of opinions. So there's no master clinician who looks after Google. That master clinician will probably have a comment or a research paper or something which may end up in Google. I'm a great face-to-face fan. We've all grown up with conversation face-to-face because it means that that practitioner, for want of a better word, has to take some responsibility for what they're telling you. Go in to your chat session with your practitioner or your patient support group with all the information that you want, preferably not 10 pages, perhaps we highlight a few things, but something out of that might be helpful. It might just make a difference. Now, we need to remember none of it is gospel. There's no such thing as, because every one of us in this room and watching has a different perspective on their quality of life and their pain levels and their discomfort and their medications and their relationship with their prescribing doctor or their specialist. So it's a very complex thing. We're comfortable with Google because Google can't answer back. Google's a one-way street. There it is. It's very easy to get the impression, particularly if you're up because you can't sleep at 2 o'clock in the morning, you've typed in something or into your AI chat box and back it comes and you think, wow, how impressive is that? It's nowhere near as impressive as having someone say to you, thank you for that information, but let's just go through it and work out what's best for you.
And I think that's a really important point, Gerald, and from our perspective as an organisation, we are very strong advocates of the important role that community pharmacists play in the healthcare team to empower consumers. And I know I have a phenomenal relationship with my community pharmacist, Jenny, and if I get prescribed a new medication, she's my go-to.
Perfect.
I go and I have a chat to her. What can we tell people who are watching today and consumers more broadly about how they can effectively engage with their community pharmacist? Like, what is it that you like when people come in and want to have a chat to you? And pharmacists are very busy people, yes, in and of their own right.
Yes.
So what sort of information do you like the consumer having when they want to come in and ask you questions?
There's a few ways around that, Helen, and every pharmacy is different. But you have a right to have access to that pharmacist. There's no point us as a profession saying we're open all the time, no appointment needed, we're medication managers, we'll be there to help if you can't actually gain access. So the best thing to do probably is to call into your pharmacy and say, when's the best time that I can have 5 or 10 minutes to run through a few serious concerns. I've written out those concerns, so we're not going to waffle on, we're going to address the concerns. Pharmacists are busy people. We can all pretend to be busy all the time. But there are times of the day where obviously it ebbs and flows. And in those ebbs and flows, there's got to be some time. And you should never ever be fobbed off and told, well, no, there's no time. Because that's not a pharmacy or a pharmacist actually performing their role into what they've been trained to do. I tend to be, and I've been 50 plus years now, 53, 54 years, and you get into a bit of a routine, and there's a magic phrase that I think clinicians never use, and it's, Helen, how do you feel? You don't have to say another word. You don't have to run through, where does it hurt, what does it do, how do you feel? And within 2 or 3 minutes, you'll get a fairly good assessment of where that person is fitting in their own health space. So look, and I know as time goes by and costs rise and we're all time poor, there has to be more availability of guided and professional information where a person is really, really concerned. Because at the end of the day, if they're given the proper advice, it may save them a lot of money, it may save the health system a lot of money, and it is frightening when you consider, and I mentioned briefly when I started about interactions and adverse events, how many of these things crop up because of those interactions. Now, they're not hard to track, but we just need to make sure everyone has a right to say, this medication, I've been on it 2 days, I feel lousy, I'm nauseous, the joint pain's getting worse, whatever. Well, something's got to be done.
Absolutely. And I think a really critical point to your entire presentation today is that this is about a team.
Yes.
This is about a team that the consumer themselves are an integral part of. They're the centre of this, and they should have and do have a role in driving their treatment, their management, because within this musculoskeletal space, these are lifelong conditions. Totally. There's not cures, as we've discussed.
Yes.
There are ways that we can take ownership of this and learn to manage them and learn with the expert help of people like yourself, pharmacists, GPs, rheumatologists, a whole raft, podiatrists, physiotherapists, a whole raft.
Yes.
But it is a team, and the consumer is the decision maker in that team. So from that, how do we also work with pharmacists and other healthcare professionals around the more informed and empowered consumer and how they effectively engage with them?
It's not the first time, Helen, that I've drawn a wheel and I've put the person's name in the middle and I've had spokes off. And as you mentioned, when you draw that for a person sitting there and you say, now look, we've got a dietitian, exercise physiologist, physiotherapist, pharmacist, and a specialist and GP and all these people all around, and most people say, oh wow. There is a system now called a care plan, and the care plan gives access to, I think, 6 practitioners, and there's normally some free visits first up. A lot of people don't realise that care plans are there to be accessed. So we have breakdowns in the system, sadly, where opportunities are there for people to gain access and benefit, but because everyone's rushed, everyone's pushed, and often the hard-working, time-poor doctor and or pharmacist isn't aware that these opportunities are there. I'd hate to think how many processes are there unused that would make a difference to a person's quality of life. And look, and we all shake our heads sometimes, and again I hear, I didn't know that was available. And that could be from a practitioner. I didn't know, none of us know, but there should be more open education about what's available. But certainly from this organisation, the drive is to empower the person. How often do we say, unless, and it's the same in a footy team, you can do what you want, but the team around you will actually support you in everything you do. And that's really educating people to become empowered in their own condition, which was one of my main thrusts today. If you're happy to just rock along and do nothing, eventually you're going to pay for it, one way or the other. But if you get more involved, more invested, and start working on improving things yourself, the system will envelop you and hasten you along your way. And at the end of the day, 3 words: quality of life. I can bowl, I can play golf, I can walk, I can meet my friends down the street, I can get out. It is horrific when you consider how many people are just not mobile enough to get out into the fresh air. And we need to stop that. We need to just say nobody should have to be in that situation, and organisations like yours will do that.
Absolutely, and I think that's a really great point to end on today, because this is what all Musculoskeletal Health Awareness Month is about. And it's not just about people living with these diseases and conditions. It's about us taking ownership of our musculoskeletal health from a very early age and saying, this is important. This is just as important as our cardiovascular health.
Sure.
Or managing our not to get diabetes and our weight.
Same thing.
All of those things. Musculoskeletal health is so central to our overall health and well-being, our mental health, so many other things it has an influence on. And that's why this month is so important to us, and so important to all of Australians living with these conditions, but also Australians who need to know that having good musculoskeletal health is going to benefit them in their quality of life.
And there's almost competition, Helen, where the cardiovascular people say, this is what you've got to do. And others say, your gut health people say, this is what you've got to do. But we can be reassured that if you follow any of their suggestions, your joints will thank you. They really will. Now, that might mean that you go out for a walk each day, comfortable walk. It doesn't have to be mountain climbing. It can just be a half-hour stroll, which you will then pick up your pace as time goes by. But you become empowered to enjoy. And if you can do something in a group, that's your brain health straight away. By doing nothing else, you're actually improving your brain and reducing the risk of dementia. So all of these things impact one upon the other. And there's no single, we're talking musculoskeletal health today, but every one of those other things will impinge positively on our joints.
Absolutely, and I think that's a really great point to end and highlight why we're doing the world's biggest sit-in.
Yes.
And why we're saying chair-based exercise is a great way to get people engaged in movement, engaged in exercise, so that, as you said, down the track, as they get better, as they feel stronger, more balanced, more solid in the way they engage with exercise, they will go for a walk down the block and meet their friends and have a coffee and be active and have all those flow-on benefits that come from having good musculoskeletal health.
And we put a smile on people's faces,
Absolutely.
which is what it's all about.
Wonderful.
So, thank you.
Thanks.